Have you just brought home a new puppy? Then you probably already know that one of the first items on your to-do list should be their vaccinations. But why are getting your pets preventative vaccinations so important? What ones do they need and when? I'm going to talk you through all of these questions and more in this video guide. In summary, vaccinations protect your dog from serious and potentially fatal infectious diseases. Mainly given in injection form, they work by stimulating their immune system to produce antibodies that fight off these infectious invaders. By making sure your new pup has all of the recommended preventative care and keeping up with their boosters, you're not only safeguarding the health of your own pet, but also the health of others' pets too. The vaccinations that your puppy needs may vary depending on where you live, whether you travel with your pet, and what kind of exposure they have to other animals. However, there are some common vaccines that most dogs should receive, so let's go over the schedule in order. Your puppy should generally be giving their first round of vaccines when they're around 8 weeks of age. And in the UK, this should include an initial course for 4 very serious diseases. The first is canine distemper. So this is a very highly contagious virus that affects the respiratory, gastrointestinal, and nervous system of dogs, causing symptoms such as coughing, sneezing, vomiting, diarrhea, seizures, and this can even be fatal. Now, distemper can be spread through direct contact with an infected animal or through the air or contaminated surfaces. The second is canine parvovirus, which I think a lot of people are familiar with. Puppies and adult dogs can catch this via contact with contaminated feces or surfaces. This is a highly infectious virus that affects the intestinal lining as well as the immune system, and it can cause symptoms such as bloody diarrhea, vomiting, and severe dehydration. Parvo can be fatal if contracted, so it's a serious one. Number 3 is adenovirus, which causes infectious hepatitis. If this is caught, it affects the liver, the kidneys, the eyes, and the blood vessels, and it's a virus that can be easily contracted through contact with bodily fluids of another infected pet. The fourth that's highly recommended is for a bacteria called leptospirosis. Now, this is a disease that can damage the liver and kidneys of dogs and can cause fever, vomiting, jaundice, and even kidney failure. Now, another note is that leptospirosis is what we call zoonotic, so people can also become infected with leptospirosis, making it even more important that we talk about this one when it comes to disease. Depending on your puppy and your vet's recommendation, each illness requires 2, sometimes 3 booster vaccinations given a few weeks apart. Now, they may also need to be over a certain age to receive their second dose. After this initial series, both the distemper, adenovirus, and parvovirus vaccinations, as well as the leptovirus vaccination, should be given a booster at 1 year. After that, leptospirosis is typically boosted annually, whereas the distemper, parvo, and adenovirus vaccine is boosted every 3 years. For our UK pups, those are the core 4, and they'll be fully protected a few weeks after their final series booster. However, for dogs living outside of the UK, a rabies vaccination is also usually highly recommended or even legally required. This is given when your dog is over 12 weeks of age with a booster 1 year later, and after this, typically boosted every 3 years to stay protected. If you live in the UK, it's only a requirement to have your dog vaccinated against rabies if you wish to travel abroad with them. If you know your puppy is going to be spending time in kennels or rubbing shoulders with a lot of other dogs on a regular basis, this is in places like doggy daycare, dog parks, any types of classes, or the groomer. Your vet may also recommend a vaccination for Bordetella, and this is more commonly known as kennel cough. Now, this bacteria is associated with the canine infectious respiratory disease complex, which can cause coughing, sneezing, nasal discharge, and potentially pneumonia. This vaccine is commonly given as a nasal spray or oral formulation, though injectable is also available. It doesn't typically require an immediate booster and then is given annually thereafter. Remember, until your new puppy has completed their vet-recommended course of vaccinations, they ideally shouldn't be going on walks in public places or in a garden where other unvaccinated dogs have been. It's all to help keep both your new pup and others safe. If you want some helpful tips from your veterinarian on safe places to walk and socialize your puppy prior to their vaccines being completed, they can give you a good list of options.